was growing up as a little child, I lost my mother. At the age of 5, I didn't have a mother. I knew my mother was expecting. And in the night, they found a way of how to take her to the hospital. I don't remember how, but in the morning, I was told they took her to a hospital. And I think it was for delivery. All of these, as I grew up, I came to know about this. It's so saddening that the following day, my mother, who had gone walking, came back in a back cloth. Along with another baby. They were all dead. For me, picturing all through this as a child, I grew up thinking what might have happened for me to lose a mother and possibly my sibling at that time. Later on, I came to understand that my mother did not have means to go to the hospital. Possibly if there was a way my mother would be taken to the hospital, to a facility earlier, maybe she would have survived. There are so many stories of this kind, but we wouldn't want to add on statistics of what has happened. So growing up, this story has shaped who the person before you is. And to make sure that I add a stone or a block on building resilient EMS.
We developed the rescue chain for the emergency medical service system. And it consists out of different components. It starts with safety, it has the emergency call, the first aid, the ambulance service, and the emergency department. So all these are components of an EMS system, whereas those 4 components are defined as pre-hospital, and this is in-hospital. Now, in order to have an emergency medical service system which is strong and also gives us impact to the emergency patient, we need to develop all of those components at the same time and strengthen them equally. Because otherwise, a chain always breaks at its weakest parts.
So the statistics in Uganda are still looking dire. But the government and the Ministry of Health have recognized that it's preventable. And to that end, the ministry in 2017 opened the Department of Emergency Medical Services. The department went on, through the support of many partners, to develop an EMS policy. In that policy, we have 13 pillars. The pillars range from governance, human resource, infrastructure, and the like. And many partners are still joining the ministry because the work is still immense to chip away at these particular themes. And today, we are here at one of the biggest partners of Ministry of Health, and that's AAPU, the Association of Ambulance Professionals of Uganda.
The Association of Ambulance Professionals Uganda right now is the leader in developing and linkage, bringing together all the professionals of emergency medical services in Uganda. Of course, there are limitations right now in terms of operational costs. The space that we currently have is not enough for our vision. And therefore, we need a better, a larger, and a more conducive environment for the training, but also to produce the human resources for health for pre-hospital that Uganda requires.
One of the things that I've noticed that people who have been trained in either the ERC courses, the International Trauma Life Support, of which I'm a course director, or the Basic Emergency Care course, often have a structure that enables them to be able to immediately identify what's going to kill the patient and be able to intervene as soon as possible. I've trained healthcare providers from across different countries in Africa. I've trained healthcare providers from Namibia, from Ghana, from Kenya, East Africa, South Africa. And this is a testimony that they all have. Some of them have gone as far as to share that when they see patients before they got to do these courses, one of the things that they would do is they had no system, so sometimes they would run away. They would run away not because they don't want to help, but because they did not know how to do it. And therefore, I think there is a value to having everyone trained in these emergency care courses.
As we are well aware, there is a global burden when it comes to injuries like trauma, other medical emergencies, as well as cardiac arrest, and this burden is even more severe when it comes to low and middle income countries. So one of the things that can improve outcomes when it comes to these situations is having health providers fully equipped and trained to manage these conditions. Courses such as International Trauma Life Support, Advanced Life Support, and the Pediatric Advanced Life Support really help when it comes to equipping the health workers with these skills. If you look at the statistics in Africa, there's very few training centers available, and a lot of the time for health workers to be equipped with such skills, they have to travel long distances. Uganda is, however, lucky to have the Association of Ambulance Professionals that has a training center within that tries to address these gaps, and we hope that with the growth of the association, we can also have the regional gaps and needs when it comes to training addressed.
I am glad to inform that I am very excited about this program because it's a lifesaver. In Uganda currently, we lose about 19 to 22 babies every 1,000 births every year. That is a very huge loss because these babies cannot breathe on their own. As a result, they die because of birth asphyxia, a common condition known as a baby getting tired. And the most common cause is a baby failing to breathe at birth. If a baby fails to breathe at birth, who is there to help? It has to be the one receiving the baby, either the doctor or the midwife or a pediatrician. And guess what? These have to be well-trained personnel in terms of skill as well as have good equipment up to standard.
In this country, we are struggling to make sure we establish a responsive emergency care system. This is due to the need which has been shown by the number of deaths which we registered due to emergency conditions. Out of the 10 top causes of mortality in the country, 7 of them are due to emergency conditions. And our target is to train an emergency care responsive team to help us reduce this mortality. The targeted numbers are training 5,000 paramedics, training 512 emergency medicine physicians, and training over 20 in-service healthcare providers in emergency. And this is the reason why we would like to establish an emergency care training college within Uganda.
As an EMT in Uganda, I know and I have experienced that it is hard to find a dedicated ambulance station in our country, even though the Ministry of Health is trying to do regional hubs. The Gulu Highway is still a killer of people when a crash or a collision happens. There are no ambulances dedicated to run quickly and be able to save those lives. We would love in this vision to build dedicated ambulance stations manned with professional EMTs. And this we are going to do through the trainings we offer.
Our vision is actually to expand this very training facility. We want an EMS training center. the EMS training center, now we would like to have a medical facility attached. The medical facility does two things. It offers a training ground for many of our trainees who come from different parts of the country. But it's also a stabilization center for the ambulance posts that we're going to have scattered along the Kampala-Gulu highway. When people are picked from the field, those people are rushed to this stabilization center. It helps us to reduce the time that people take from the time of accident to the time of receiving care. Once people are stabilized at this center, they are then sent to the definitive centers that are nearby along that highway.
Training of personnel that work in the out-of-hospital space, or what we call EMS, is something that is very essential in the development of emergency care in Uganda and Africa as a whole. There have been some few countries that have dedicated programs that provide training for EMS personnel, such as South Africa or Egypt and Ghana. Though in the region, apparently we do not have many that are dedicated to training personnel in EMS. So the development or building of this ambulance college will be the first of its kind in the region, and I believe will serve the greater Uganda and the greater East Africa region quite widely. There's a lot of interest in the training, a lot of demand for people that work on EMS, and as well, there's a lot of employment opportunities for people that work in the EMS space. We believe by training and having a dedicated center, we will have top-notch personnel in EMS that will serve both the country as well as the region. So we're very excited about the ambulance college and are looking forward to the first of its kind ambulance college in Uganda.
I think it is the only right thing to do for AAPU to become independent and sustainable, because we do not know for how long AAPU can still rely on any kind of funds. So it's first of all the right time. Now the knowledge and the capacity AAPU has for a very long time. You can tell that story. We know it, we have seen it. So they are very much ready for their own building, for a training center.
In building up this huge, complex emergency medical center, we are pulling all hands on deck. We are pulling our friendships, our international relationships, partners, everyone who we can talk to, everyone who we can reach. We are calling upon, also internationally, to build up a comprehensive, state-of-the-art emergency medical center. And as we have heard, this is going to comprise of several parts, and all of this will enrich a rescue chain which supports the emergency medical services in Uganda. This will not only be a hub here, but this is going to be an East African center of excellence. So let us gather together, let us rally together, and let us build up a comprehensive EMS center to save lives for children, babies, mothers who are expecting. We have lost leaders on these roads. Let us come together and prevent all this and reduce the mortality rates to nothing.
I call upon each one of you in your different capacities to come and rejoin hands. We can make a better emergency medical services for Uganda, you and I.